Hi, I'm Greg Pope, founder of SpinalSurgeryMexico.com. I'll be your first contact for getting in touch with Dr. Simone. Today we're here in the city of Querétaro to pick up Raymond from British Columbia, Canada, that's come to have a lumbar surgery with Dr. Mario Simone, MD, FACS, Fellow of the American College of Surgeons, and we thank you for watching the video.
Raymond.
Dr. Simone.
Hi Raymond, nice to meet you.
Nice to meet you.
You have a huge herniated disc, L4, L5 at the left. Okay, it's huge. I mean, it's one of the biggest I've seen in my life.
I've been walking on my hands and knees for 3 weeks.
That's terrible. Hello everybody. Today I'm making a house call to San Miguel de Allende, Mexico, to see how is our last patient, Raymond Rousseau from Canada, did with his first week of surgery. And I'm glad to tell you that he's doing just very, very good. I'm so glad to tell you that the pain he has taken here to Mexico has gone, and he's completely satisfied about the results. What Raymond has is an herniated disc, far lateral to the lateral recess, and he was compressing the left sciatic nerve. And of course, he had a lot of pain in the left leg, which disappeared just immediately after surgery. What we did with him, it was we take off the articular process between L4 and L5 at the left side in order to gain a good decompression of the nerve, which we did with the microscope, surgical microscope. And after that, after we take off these articular processes, we produce some stability there. So we put 2 screws in that levels, in L4 and L5, in the left side, in order to maintain that stability in that segment with just the 2 screws and rods. We use the dynamic cosmic system in order not to fuse the segment and to produce immobility of that segment. So he could have also his flexion and extension normal movement at that segment. And he's just doing great. And I think in 1 more week, he could be able to take out staples from the skin, and he looks great. This man, I talked to him 2 weeks before he came here to Mexico, and he was telling me that he was using a wheelchair and that he had to crawl to the bathroom. He couldn't stand up. And as he came to me in a wheelchair to the hospital, now he's going home. He's going back home walking like every one of us who doesn't have any problem in the spine. So please feel free to contact us in case you have any spine problem. It's even cervical, thoracic, or lumbar spine. Please call us.
So that was the pain that was the most debilitating because no matter how I moved, it radiated on my shin bone.
Even if you were at rest?
Even at rest. Oh, it radiated there all the time.
Okay.
Yeah, so
it was constant?
Yes.
24/7?
Yes.
Okay, that was before surgery.
That was before surgery, and I had mentioned that to you on the phone. I told you where it would start, where it would go, and then there was the odd time that it would locate behind my knees. This knee primarily.
I'm just trying to get back to those days because you have some memory for pain.
Yeah.
It's normal. It's very important to do a difference or to realize that there is a difference between the pain you used to have before coming here and the pain you have now.
Yes.
First of all, the intensity. Second, location.
Yeah.
And quantity. Okay, all that stuff matters.
Yeah.
Because when you get rid of the decompression of the nerve, you can, of course, get rid of the main pain, and then after days go by, you can feel different things.
Yeah.
And the nerve is inflamed, it's irritated because of the long compression it had.
It had been compressed for a long, long time. You know, you got it probably the straw that broke the camel's back was November of last year.
Okay.
And that's when it became, I needed painkillers like on a regular basis.
Okay. That was 8 months ago.
Yeah.
Okay. One important thing is that you came here with one main pain, which was your left leg.
Yes.
I mean, that was a great picture about your problem.
Yeah.
And then after surgery, you have changes. I mean, that pain has changed, and you have a new pain, which is the scar.
Yeah. Well, the pain.
Which are very different.
Do you remember when you said the back pain, or pardon me, the leg pain would be left on the operating table?
Yeah.
That's true. That happened.
Perfect.
What I wasn't prepared for, and it wasn't until I called and talked to my wife that it's normal, was the pain that can be associated to a surgical procedure.
Yeah.
The surgical pain, the fact that I have not used my muscles properly in months, that in itself is a real kick in the slats.
Yeah.
Yesterday, Greg took me for a walk. We walked, I guess, 120 meters down the road to a park.
To a park, yeah.
Walked around the park, and I came back here, and I think I was all teeth. It was the best sensation ever. It's like, well, that park for me was about as good as Disneyland.
Yeah, of course.
I went down there. I could walk around. I could see things.
I can bet on that.
Okay, face
Just
down.
Face down, please. Just to take a look at the scar, and then looks great. Okay, it's a little bit swollen, just a little bit. There is no any sign of infection. Okay,
That's good.
that's perfect. That's perfect. And I think it's going to be ready in 1 week to take out staples. You're going to heal perfectly in 2 months. But you can go to your meeting next week. Yeah, and tell everybody, hello, 2 weeks after surgery,
I'm back.
I'm back. Okay, I'm going to raise your right leg. You don't move anything, okay? Just relax. Does this cause any pain?
No, that's just stiffness.
The stiffness.
Yeah.
Okay. Pull with the tip of your toes.
Up to me.
Yeah, up to your head. Yeah, that's right. That's fantastic. Your strength is perfect. That's fantastic. Now push, please, both legs. Oh, that's great. Now bend your right leg, please. Pull it up here. Yeah, perfect. Fantastic. And what about this one? Yeah, that was the bad one.
That was a bad leg. Yeah.
You're just perfect. I'm so happy.
Not as happy
I hope
as I
you.
am.
Oh, really?
Yeah.
Don't tell.
Okay. All right.
Fantastic.